is an historic moment. Many of you will know our hospital at Warnford in Oxford. It's a fantastic old building around which there is a large brick wall. And the symbolism in the history of mental health services in this country is separating out mental health from ordinary life. The existence of this hub breaks down that wall.
Ladies and gentlemen, on behalf of the citizens of Abingdon and as a representative of the town criers, it gives me enormous pleasure to open this centre wellbeing hub for Abingdon. Thank you so much.
So people can just walk in off the street. We hold drop-in sessions every day. For 4 hours a day, people can just walk in and speak to somebody. They can get support that they need immediately, and they can also get lots of information about local organisations that will help them in their community.
Mental health has always been this sort of cloud that's there, that's becoming more spoken about, but still has a stigma attached to it. We couldn't be more central to Abingdon High Street here. And it's, NHS, right in the middle. We're a mental health service that has got open doors, so we're welcoming people in. And having those conversations, bringing those people in, that's, for me, that's the bit that I really enjoy, and the thing that I think is wonderful is that aspiration that we break down that stigma, and anyone can get mental health problems at any point in time, and we're here to help.
I think it's just really useful that they can just have a conversation, and because you have more than one individual coming in, I think it creates a really good atmosphere as well, and allows others to connect and also know that there are other people using the hub but also have mental health difficulties. And I think that's what's quite nice, because I think sometimes it is very isolative. They do feel like they're on their own, so if they see other people accessing it, they know actually I can do that too. And that's what I think is really, really great about this service, or being able to be part of the hub.
That's something that's very important. I think Linda and other colleagues who support people to find a pathway into employment and identify employment that people can access is crucial to maintaining our mental well-being, our mental health.
The hub provides a range of services, all helping people in their recoveries. A recovery can look different from person to person. Where I come in is the individual placement service. We help people find the right job and maintain the job once they get the job, and sustain it through reasonable adjustments, both on the part of the employer and the employee.
So we've worked with South and Vale District Council and Make Space here in Abingdon to create some art in the hub that has a link to mental health and well-being. So we asked local artists to, if they would like to display their artwork along the theme of hope, community and well-being. And it's displayed in the hub for people to see when they come in and to talk about.
We've got lots of feedback from people who've used the services, whether it be from the specialist intervention workers, the Elmore workers, or the psychology groups, and the peer support workers. Really, really good feedback around accessibility, how quickly being seen, not being bounced around services, really trying to get help in the right place, and so some really lovely feedback from across the board, different ages. People who've had lots of experience with mental health issues in the past, who have struggled with services, or people it's the first time they've come in and kind of saying that this isn't what they expected, this is so much easier and more friendly. So yes, yeah, really good. We've definitely seen a huge reduction in referrals into our secondary care teams. It's because obviously most come here now, and the advantage of that will mean that we can relook at how the secondary care or the specialist mental health teams work, and really enable them to focus on people with the real complex, serious mental health issues, and really give them some evidence-based interventions and the time that they need, which they haven't been able to do kind of up until now.
I love it. Like, I was told by my psychologist when I went through my journey about peer support, and I'd never heard about it before, and then it just came up and now I do the job.
Talking to the peer support workers and some of the ideas they've got are things that they want to do because they see and they hear from people what's missing or their experience of things that are missing. So I know that, you know, a couple of the peer support workers here have got plans to set up groups or things that they've got a real special interest in, and they're running with that.
I think it brings like a real understanding, and it stops the barrier because it's not clinical and it's not therapeutic, but it's that somebody gets it from a real kind of raw perspective, that we've lived it or we've been through something similar and we've gone down a journey, and it gives people that realisation, that hope is possible, that you can get through it, and that, you know, it gives people that hope and that joy that maybe they can get there as well, but we can walk alongside them doing that.
As someone who is a clinician, I think it's a lot harder to be able to have that connectivity with people because, you know, I haven't experienced it myself. So to be able to have someone who can help them on that level and know that actually they've also been able to, you know, through a journey of recovery, you know, being able to then be employed within the NHS is just fantastic.
We are currently working on sorting out leases in Cowley Road, in Kidlington and Wantage. All three will be up and running by the end of March.